Lupus is a chronic autoimmune disease that mostly affects women. It can increase the risk for complications during pregnancy, but now more than ever, doctors are able to help women get through their pregnancies and deliver healthy babies. Here's tonight's Health Watch.
2-year-old Gabriella proudly wears this shirt. Her mom is a lupus warrior. Kiana Cornejo has been living with the autoimmune disease since she was just 11 years old.
When I first got diagnosed, I felt like I was paralyzed at one point. I couldn't do anything. Everything was just hurting.
Common symptoms include fever, rashes, joint pain, and swelling, as well as hair loss. Some medications for lupus are not safe for pregnancy, something Kiana worried about when she found out she was expecting, which was not planned.
I immediately called the doctor. I was terrified.
Their pregnancies are not like the average pregnancy. Between the risk of active disease and sometimes the risk of the medications that they need to take.
Rheumatologist Dr. Lisa Samaritano at Hospital for Special Surgery says the prognosis for a woman with lupus to have a successful pregnancy is better than it's ever been.
Having quiet disease before one becomes pregnant is perhaps the best thing you can do. They really have to plan, sometimes even years ahead of time, so that they have quiet disease on medicines that are safe to take during pregnancy.
The dosage on some of Kiana's medications were lowered, and both mom and baby were monitored closely. Her lupus symptoms remained stable.
I felt healthy until after I gave birth to her.
Kiana's been dealing with a major flare-up since then.
The symptoms I'm having now are worse than before. I'm losing a lot of hair. I'm getting a lot of headaches. I'm very tired, going through a very tough time to kind of deal with these symptoms now.
She's working with her doctors to try to manage her disease and be able to enjoy more time with her family.
And according to the Lupus Foundation of America, scientists believe lupus is triggered by a combination of genes, hormones, and environmental factors. For a closer look, go to the feature section of our website, 2news.com, and click on the Health Watch icon.